Death marks the end of our existence as a living organism. But what exactly happens to our body in the minutes, hours, and days following when our heart stops beating and brain activity ceases? Within seconds after the heart stops, blood circulation halts, oxygen levels deplete, and the brain shuts down. The state of clinical death is reached in just a few minutes as tissues start deteriorating from lack of oxygen. Even if the heart could be restarted, severe brain damage is likely after 3 to 5 minutes without oxygen. Within an hour of death, muscles totally relax as all bodily systems enter a complete shutdown. Subtle facial movements from remaining muscle activity may still occur during this time, misleading some to think the deceased is still alive. The skin also begins to cool as the body is no longer producing heat. In the hours after death, blood pools to the lowest parts of the body through gravity, creating a purplish discoloration of the skin called livor mortis. The body temperature drops to match ambient levels in a process known as algor mortis. Rigor mortis also sets in 2 to 6 hours after dying, as muscle fibers contract without relaxation, starting with the eyelids, jaw, and neck, before progressing to other muscles over the next 24 hours. Decomposition of tissue starts almost immediately after death. Within 12 to 24 hours, digestive enzymes start digesting the organs and tissues they once nourished in a process called autolysis. Bacteria from the gastrointestinal system also spread through the body once immune functions stop. Decomposition from bacterial activity really accelerates after 36 hours. Around 24 hours after death, dentin exposed in the teeth can give the appearance of an exaggerated smile called a death grin. The eyes also begin sinking into the skull as body fluids dissipate, and skin discoloration spreads as hemoglobin breaks down. In rare cases, decomposition gases can force blood out of the nose and mouth. In the days after death, cell membranes deteriorate and release enzymes that begin eating through tissues. This liquefaction releases cadaverine and putrescin, which are foul-smelling chemicals causing bloating and discoloration of the body. The bacteria breeding inside the body also release gases causing swelling and disfiguration. Within a week after death, internal organs have largely liquefied. The body starts drying out, becoming leathery and discolored. Hair, nails, and teeth may fall out as connective tissues break down. Liquids released through orifices need to be contained to avoid staining the death scene. From 2 weeks to 1 month after death, maggots and insects arrive if the body is exposed, feeding on decaying flesh and accelerating decomposition. As connective tissues dissolve over the next months, larger body segments detach and skeletonization sets in. This process can take from 6 months to over a year depending on environmental conditions. Ultimately, all that may remain of the physical body is the skeleton, as natural processes break down all tissues. Preservation techniques like embalming and mummification can significantly delay this process to maintain a recognizable appearance longer. However, even preserved bodies eventually decay over the course of decades or centuries. Beyond the observable physiological changes, some speculate that death may trigger as yet unknown quantum transformations leaving the body behind. But any scientific hypotheses of consciousness persisting in some way remain conjecture. As far as medical science knows today, all measurable bodily functions definitively cease at death. While some cultures maintain burial customs to care for the body's remains, the organic matter that once animated as a living person ultimately disintegrates and returns to the earth. The relics left behind act as reminders of the deceased, rather than representing any persistent essence. Physical death marks the conclusive end of one's functioning organism and lived existence. The mystery of what death might subjectively feel like remains open for debate, depending on beliefs about the separation of mind and body. But the physiological processes that unfold over hours, days, and years after death follow a predictable timeline of organic breakdown. Understanding this biological reality of death can shed light on the scientific truths underpinning the transition we will all one day undergo.